My doctor said I might need neck surgery. Watch this first. If your doctor just told you that you might need surgery on your neck, I know exactly how you're feeling right now. Scared, confused, wondering if there's another option. I'm Dr. Moss, and this is Prime Mover Health. I'm a physical therapist with over 28 years of experience treating people with serious neck injuries just like you, before surgery and after. And before you make any decision, I want to give you the information I wish every patient heard first. I'm not here to tell you surgery is wrong. Sometimes it's absolutely the right call, but there are things you deserve to know before you get on that table. Let me be clear about when surgery is the right answer. When you have progressive neurological loss, that's weakness getting worse, loss of hand coordination, balance changes, bowel or bladder changes, this is an emergency. Do not wait. Intractable pain that has failed a genuine course of conservative treatment. If you have any of those red flags, surgery may be your best path forward, and a good surgeon can absolutely change your life for the better. But here's the key phrase: a genuine course of conservative treatment. And that's where things get complicated. A lot of patients tell me they've already tried physical therapy. When I ask what that looked like, they describe 6 visits of maybe hot packs, maybe some ultrasound, some very generic exercises at a clinic where they didn't do any hands-on techniques or work with them, and they saw someone different every single time. That's not what I mean by conservative treatment, and it's not what the research means either. A real course of conservative physical therapy looks like skilled manual therapy from a fellowship-trained clinician, specific progressive exercises targeting the actual diagnosis. 8 to 12 weeks, that's right, 8 to 12 weeks of consistent directed treatments. That's why I've developed the 5 phases of healing that we take our patients through from phase 1 to phase 5 to give them maximum recovery potential. It's a clinician who puts their hands on you and knows you by their name. The research is very clear. For most cervical disc herniations and many cases of spinal stenosis, a proper conservative approach produces outcomes comparable to surgery at 1 to 2 years without the risk, the recovery time, or the scar. But you have to do it right, and a lot of people never get that chance. That's what being a prime mover in your own health means: asking the hard questions and making sure you've exhausted the right options. So if you're facing this decision, here are 5 questions I'd want you to ask. 1, have I completed a full course of skilled physical therapy with a specialist? Not 6 visits of generic exercises that either you got from your physician, a handout of generic exercises, or something you did search for on YouTube. That's not skilled physical therapy. 2, is my condition getting worse neurologically, or is it stable? If it's stable, try conservative care first. What does my surgeon say the success rate is for my specific situation? And what does recovery from the surgery actually look like realistically? What happens if the surgery doesn't fix my pain? These aren't confrontational questions. A good surgeon will welcome them and sit down and explain those answers to you. Now, let me tell you a little story, and it's quite personal because it has to do with my neck. Years ago, I woke up with some neck stiffness, some shoulder blade, scapular pain and tightness that was referred from my neck. Didn't know what I've done. I've had multiple bicycle crashes, weightlifting, sleeping weird in postures, who knows what it was. And so I started going through skilled therapy. I had my therapist working on me. I was doing neck traction. And then one night I slept in a different bed and I woke up with more pain and actually difficulty, neurological, difficulty raising my arm. So I went and had an MRI, and I had extruded or basically blown out the C6-7 disc. The crazy thing is, once that disc ruptured, the pain dropped significantly. Now I had some weakness to go forward with it. And so I had a choice. Do I continue to treat conservatively, like I know I can, or do I go and get surgery? Well, I chose the conservative path. And it took several months to develop and build back my strength and a little bit with my upper thoracic mobility and my neck stabilization. But I'm back to 100% with occasional twinges of neck pain or soreness in the right side if I work a lot on patients or if I ride my bike for too long. But I did that so just to avoid surgery. I didn't want surgery at the time, and I still wouldn't do it. I have no issues. And so those are personal decisions that you have to make, but you have to make sure that you understand the pros and cons of each one and have those discussions with your surgeon as well as your therapist, and really give conservative care a good 6, 8, 12 weeks of true treatment, including following through with your home exercise program as prescribed, to really give yourself the best chance of avoiding surgery if that's something you truly desire, outside of all the red flags and neurological issues that I previously discussed. So for me, PT, conservative care, was actually the right choice, which helped me recover faster and avoid surgery. So whether you end up in the operating room or not, the best thing you can do for your neck is make an informed decision. And that means understanding all your options, not just the surgical one. If this video gave you some peace of mind or helped you think about your situation differently, I'd appreciate a like and a subscribe to Prime Mover Health. I make these videos because I believe everyone deserves access to the kind of information I give my patients face to face. And if you're looking for a physical therapist who specializes in this, whether it's before surgery or after surgery or instead of surgery, I'll leave some guidance in the description for what to look for. Until next week, move well and live well.